So hello students, welcome back. Let us now discuss a very important topic from the MCQ point of view, students. A very important topic, the posterior triangle of the neck. Posterior triangle of the neck. Okay, we'll start with the posterior triangle. Now that you know the subdivisions of the triangles, let me just quickly draw this subdivision and then we start with the posterior triangle of the neck. Okay, students, have a look at this. We draw a small face here because we need the neck now. You know this. Practice this, huh? Practice drawing this. That's the body of the mandible. That's the ramus. That's the angle of the mandible. That's the mastoid process. This is the sternocleidomastoid. Okay, I need an eraser here. What's this? That's the trapezius. That's the midline of the neck. This is going to be the clavicle here, right? That's the clavicle. Fine. So we draw a line from the angle to the mastoid process. That becomes the neck. So this is the anterior. That's the posterior triangle. This posterior triangle was further subdivided into two triangles, the occipital and the supraclavicular triangle, by the inferior belly of omohyoid. We'll see that later. Now, these are the boundaries of posterior triangle. So what are the boundaries, students? Anteriorly is the sternocleidomastoid, posteriorly is the trapezius, below is the clavicle. So that's the posterior triangle. Boundaries. Understand the floor of the posterior triangle. Very important from MCQ point of view. The floor of the posterior triangle from above downwards. Let me tell you like this. From above downwards is formed by. Okay, have a look. The first muscle here, the first muscle lying in the floor is known as the semispinalis capitis. This begins from the vertebrae, cervical vertebrae, to the from the spines to the occiput. Capit to the capit. So semispinalis capitis. The second muscle in sequence here is known as the splenius capitis. So one is semispinalis capitis. The second one is splenius capitis. The third muscle here, I'll draw with a different color so it will be easy for you to identify, to understand. Okay. So the third muscle here is known as the levator scapulae. Levator scapulae. So the first muscle, semispinalis capitis. The second muscle is splenius capitis. I'll label this. Just 2 minutes. Levator scapulae. Now coming to the next muscles, that we know of, this one, this becomes the scalenus posterior. Scalenus posterior. Now this becomes the scalenus medius. Scalenus medius. So scalenus posterior, scalenus medius. So earlier we used to include scalenus anterior also in the floor of posterior triangle. But recently it is said that scalenus anterior lies behind the sternocleidomastoid, right? This muscle is sternocleidomastoid. Let me make it slightly thick for you. This muscle is the sternocleidomastoid. So it is now said that the scalenus, anterior lies behind the sternocleidomastoid. Students, we do not include the scalenus anterior in the floor of the posterior triangle. Am I clear? A very important MCQ for you. Scalenus, or the floor of the posterior triangle, is formed by all except your answer, scalenus anterior. Scalenus anterior, right? So floor of the posterior triangle from above downwards. Let me just label this for you. This muscle is semispinalis capitis. Semispinalis capitis. The second muscle is splenius capitis. The third muscle is levator scapulae. Levator scapulae. The fourth is scalenus posterior. Scalenus posterior. This is the scalenus medius. Scalenus medius, right? So semispinalis capitis, splenius capitis, levator scapulae, scalenus posterior, scalenus medius. Scalenus anterior is not there. All these muscles are lying in front of the cervical vertebrae, or all these muscles are lying around the cervical vertebrae. All these muscles are therefore known as the prevertebral muscles. Prevertebral muscles. And all these prevertebral muscles would be covered by a fascia. Any guesses? These muscles are known as the prevertebral muscles. Why? Because they lie in front of the vertebral column, right? And all these muscles are going to be covered by a Deep fascia of the neck. Now you guess this. Simple, eh? It's simple. It's in front of the vertebral column. What do you call this as? The prevertebral fascia. Prevertebral fascia. So all these muscles would be covered by the prevertebral fascia. Students, can you tell me if these muscles are lying in the floor of the posterior triangle, if these muscles are covered by the prevertebral fascia, where would the prevertebral fascia come to lie for the posterior triangle? Any guesses? Floor. Floor, yes. Prevertebral fascia is covering these muscles, no? And these muscles are in the floor. So automatically the prevertebral fascia lies in the floor of the posterior triangle. Am I clear? Floor of the posterior triangle from above downwards is formed by the semispinalis capitis, the splenius capitis, the levator scapulae, scalenus posterior and scalenus medius. The floor is covered by the prevertebral fascia. Am I clear? Perfect. Right. So this becomes the floor of the posterior triangle. Let us understand the contents of the posterior triangle, right? To understand the content, students, let me draw a slide for you. I'll draw it here only. I'll draw it here only. Just have a look at this. See if you can understand this. Now, these are the cervical vertebrae. Just try to understand. These are the cervical vertebrae. And that's the first rib. That's the first rib here. Cervical vertebrae, first rib. On the first rib, we get a tubercle here. Any guesses? On the first rib, we get a tubercle by the name of a scalene tubercle. Scalene tubercle, right? That's a tubercle on the first rib. So these are the cervical vertebrae. That's the first rib. Okay. Let us just begin with the muscles that we have drawn here. Okay, so this muscle begins from the transverse process of the cervical vertebrae, comes and gets inserted into the scalene tubercle of the first rib, the same one that we have put here, the same one that I have drawn here. This is a lateral view, and what I'm drawing now for you is a view from front, anterior view. So this muscle is the scalenus anterior. Very good, the scalenus anterior. One more thing can I tell you? Now, there's something lying on the scalenus anterior. There's a nerve, in fact, lying on the scalenus anterior. Another extremely important MCQ for you students, nerve lying on the scalenus anterior. And that's how you identify this muscle as the scalenus anterior. The nerve is phrenic nerve. Phrenic nerve. So the nerve lying on the scalenus anterior is phrenic nerve. Remember that, right? Coming to the second muscle in sequence, look how beautiful. Look, try to appreciate this. A muscle which begins from the cervical transverse processes, a muscle inserted into the first rib on a posterior aspect. That's the scalenus medius. Scalenus medius. Now, a muscle beginning from the cervical vertebrae and going to the second rib. I'm not drawing the second rib here. I'm not drawing the second rib. The third muscle. This is number 3. That's the scalenus posterior. Scalenus posterior is attached to the second rib. So, scalenus anterior, medius, posterior. Now, go up in sequence. What is this muscle? The next muscle in sequence, I've just drawn like this for you. What is this? Levator scapulae. Clear? That's the levator scapulae. Then, okay, so this is scalenus, right, so this is scalenus anterior, this is scalenus medius. So I'll do one thing, scalenus medius I drawn with this color, so I'll just draw this color, so there won't be any confusion for you. This is scalenus medius, which is attached to the first rib on a posterior aspect. The next muscle that we had drawn here is levator scapulae, right? This is scalenus medius, this is scalenus posterior. Fine. This is scalenus posterior. So no confusion. So same colors I'm using. Right? Scalenus posterior. The next muscle that we draw is the levator scapulae. Same way we draw this as the levator scapulae. That's the levator scapulae. So scalenus medius, scalenus posterior, levator scapulae. Now comes the next muscle. That's the splenius capitis. Splenius capitis. How have we drawn this? Splenius capitis. And this muscle is the semispinalis capitis. Semispinalis. So semispinalis capitis, splenius capitis, levator scapulae, scalenus posterior, and scalenus medius. Now, if I draw a muscle here like this, students, guess this. What is this muscle here? This one. What's this? Trapezius. And what is this muscle exactly going like this? That's the sternocleidomastoid. Right? So this is the sternocleidomastoid. The same thing I've drawn for you. Are you able to understand this? This is a view from side. This is a view from front. So the floor of the posterior triangle, semispinalis capitis, splenius capitis, levator scapulae, scalenus posterior, scalenus medius. Scalenus anterior lies behind the sternocleidomastoid. Scalenus anterior is not included in the floor of posterior triangle. Perfect, clear? Now, why I have drawn all these things for you, let me tell you this. Let me tell you this. That's the manubrium, that's the body of the sternum. Now you tell me, what is this? Behind this manubrium sterni is the arch of aorta. There's an artery which begins from the arch on the left side. The artery crosses the first rib and now the artery goes down. So what is this artery? The subclavian artery. The subclavian artery comes to lie between the scalenus anterior and the scalenus medius here. Scalenus anterior is behind this. That's the scalenus medius. So what is this artery? Subclavian artery. So what is the subclavian artery going to form for the posterior triangle? Any guesses? The subclavian artery begins from the arch on the left side, goes behind the scalenus anterior, comes between the scalenus anterior and the medius, and that's how the subclavian artery becomes a content of the posterior triangle. Are you able to understand? Now we've discussed the boundaries, we've discussed the floor. I'm now telling you the contents of the posterior triangle. The first content is the subclavian artery, which lies between the scalenus anterior and the scalenus medius. The subclavian artery, after it crosses the first rib, what is this now? This now becomes the axillary artery. So this much is the scalenus, the subclavian artery. And this subclavian artery is divided into three parts. By whom? Scalenus anterior. Scalenus anterior. You can see the scalenus anterior. Behind the scalenus anterior goes the subclavian artery. It goes behind the scalenus anterior, right? And this scalenus anterior is going to divide the subclavian artery into three parts. This is the first part. Behind the muscle is the second part. And that's the third part of the subclavian artery. Just remember, subclavian artery is divided into three parts. By whom? The scalenus anterior muscle. Clear? Understanding now? Very good, very good. You are all excellent students. Yes. Now, there's something else. This is C5, this is C6, this is C7, C8, and T1. And look who's come here. Look who's come here. That's the brachial plexus. That's the brachial plexus. Like this. So, the brachial plexus comes to lie between the scalenus anterior and the scalenus medius. What's that? Brachial plexus. So when we are discussing the contents of the posterior triangle, number one is the subclavian artery. Number second is the brachial plexus. Brachial plexus, it comes between the scalenus anterior and the medius. I've just drawn it here for your understanding. Okay. So one is subclavian artery, second is brachial plexus. That's the content. The third most important content of the posterior triangle. And look at this, students. Look at this. This is a nerve. And this is a nerve. I'm just drawing it like this. I'm just drawing this like this. This is a very, very important MCQ as far as posterior triangle is concerned. This is a nerve which lies on the levator scapulae. This is a nerve which lies in the posterior triangle. It becomes the content of the posterior triangle. Any guesses? Any guesses? Now, this is the nerve which first supplies the sternocleidomastoid. Students, understand? It first supplies the sternocleidomastoid. Now it comes in the posterior triangle of the neck. It now lies on the levator scapulae and it is now going to supply the trapezius. Have I not told you this nerve? The nerve which supplies the sternocleidomastoid and the trapezius. Who's that? The spinal accessory nerve. Spinal accessory nerve. Lies on which muscle? The levator scapulae. So that's the spinal accessory nerve which lies on the levator scapulae, and this is the most important content of the posterior triangle. It is very superficial. The nerve is very superficial. It lies on the levator scapulae. And why is it so important, students? In this posterior triangle of the neck, we get large number of lymph nodes. We get plenty of lymph nodes in this posterior triangle, and these lymph nodes are matted in tuberculosis. They become very hard in tuberculosis. Now, this spinal accessory nerve being very superficial, it gets entangled, it gets caught within this lymph nodes. Now, a surgeon is removing a lymph node. A surgeon is doing an excision biopsy. So, as the surgeon is dissecting a lymph node, the spinal accessory nerve is caught within the lymph nodes and the spinal accessory nerve is accidentally damaged. Right. So students, can you answer this MCQ? Damage to the spinal accessory nerve in the posterior triangle of the neck leads to paralysis of which muscle? Come on. The MCQ is open to all of you. Can you answer this? Damage to the spinal accessory nerve in the posterior triangle of the neck leads to paralysis of. What are you saying? Sternocleidomastoid and trapezius? Yes. What are you saying? Yeah. What did you say? Trapezius alone? Yes. Can you tell me why? So, suppose if we cut this nerve in the posterior triangle of the neck, a surgeon cuts this nerve in the posterior triangle of the neck. Which muscle is affected? Trapezius. Trapezius is affected. Sternocleidomastoid is spared. Sternocleidomastoid is spared because the nerve first supplies the sternocleidomastoid. The nerve then comes in the posterior triangle of the neck to lie on the levator scapulae and goes to supply the trapezius. Students, am I clear? So if this spinal accessory nerve is cut in the posterior triangle, the muscle paralyzed is going to be trapezius, and trapezius alone, not the sternocleidomastoid. What will the person complain of? Difficulty in shrugging of shoulders, right? Difficulty in shrugging of shoulders, difficulty in abducting the arm above, that is overhead abduction, difficulty in overhead abduction. Clear? Perfect. Students, are you able to follow this? So what are we discussing, children? We are discussing the contents of posterior triangle. Number one is the subclavian artery, divided into three parts by Scalenus anterior. Number two is the brachial plexus. Number three is the spinal accessory nerve. And here we come to number four. Number four is a plexus which is formed in the neck. Neck, cervix. Plexus, name cervical plexus, the cervical plexus. Okay, so we get the branches of cervical plexus in the posterior triangle of the neck, and the branches are around the subclavian artery. The branches of cervical plexus are around the subclavian artery. Let me just tell you this: branches of cervical plexus. Students, are you able to follow? No? Just one moment. Let me just once again recapitulate. So boundaries of the posterior triangle: anteriorly is the sternocleidomastoid, posteriorly is the trapezius, the base is formed by the clavicle. The floor of the posterior triangle from above downwards: semispinalis capitis, splenius capitis, levator scapulae, scalenus posterior, scalenus medius. Scalenus anterior does not include, it's not included in the floor of the posterior triangle. Now the same side view I put in a front view. So that's the semispinalis, that's the splenius, that's the levator scapulae, scalenus posterior, scalenus medius. For your understanding, I've drawn the scalenus anterior also. On the scalenus anterior lies a nerve, that's the phrenic nerve. So this becomes the boundaries of posterior triangle. That's the floor. The floor is covered by a fascia, the prevertebral fascia, right? And the contents of posterior triangle is this subclavian artery here, the brachial plexus. And what is this here? Prevertebral fascia. And this subclavian artery and the brachial plexus will pierce the prevertebral fascia. You are able to understand the students. Okay, just let me see if I can draw this for you. Let me see if I can draw this. One moment. Look, if I can draw this for you. Okay, so what is one moment. Okay, no, this is not coming like that. Okay, let me see if a highlighter is coming. Right. So what is this? If I draw something here, what is this? This entire thing is covered by a fascia. What is this fascia? Known as prevertebral fascia. Look at this. This entire thing is covered by the prevertebral fascia. So prevertebral fascia comes to lie in the floor of the posterior triangle. Perfect. Now this subclavian artery and the brachial plexus, what is it going to do? It is going to pierce the prevertebral fascia. The subclavian artery and the brachial plexus are going to pierce this prevertebral fascia and get out, right? They pierce the prevertebral fascia and they get out like this. And now the same prevertebral fascia is going to enclose them. The same prevertebral fascia is going to enclose the subclavian artery and the brachial plexus, and the same prevertebral fascia is carried in the axilla. The axillary artery and the brachial plexus are put on a sheath. That's the axillary sheath. So this axillary sheath is derived from the fascia of a neck, and that's the prevertebral fascia. Am I clear? The same prevertebral fascia is carried by the axillary artery and the brachial plexus in the axilla, now known as the axillary sheath. A very important MCQ. Axillary sheath is derived from, your answer is going to be the prevertebral fascia. Prevertebral fascia. Okay, I hope this is clear to all of you. Bacho, enjoying students, the posterior triangle of the neck. Okay, so contents: number 1 is the subclavian artery, number 2 is the brachial plexus, number 3 is the spinal accessory nerve, and number 4 is the cervical plexus. Let me now tell you the branches of cervical plexus. It's a plexus, so it will have branches. Number 1, there's a nerve which winds around the spinal accessory nerve, goes up to supply the skin over the occiput. The nerve which winds around, that's an MCQ, the nerve which winds around the spinal accessory nerve goes and supplies the skin over the occiput, and this is what we call as the lesser occipital nerve. Lesser occipital nerve. Okay, so it winds around the spinal accessory, goes up to supply the skin over the occiput. That's the spinal accessory, that's the lesser occipital nerve, a branch of cervical plexus. Second is the nerve which comes here and which supplies the skin over the angle of mandible. It supplies the skin over the angle of mandible, and this is what we call as the greater auricular nerve. We know this, right? Skin over the angle of the mandible is supplied by greater auricular nerve. That's a branch of cervical plexus. There's a nerve which goes transversely in the neck and divides into two. Transverse in the neck, cervix, supplies the skin, cutaneous. What do you call this as? Transverse cervical cutaneous nerve. Transverse cervical cutaneous. And the last nerve goes above the clavicle. The last nerve goes above the clavicle and divides into three. What is this known as? The supraclavicular nerve. That's a supraclavicular nerve. So this is the transverse cervical cutaneous, and that's the supraclavicular nerve. So this becomes the contents of posterior triangle. One, let me just tell you, one, subclavian artery is clear. Second is the brachial plexus. Third is the spinal accessory nerve which lies on the levator scapulae. Fourth are the branches of cervical plexus. In that, number 1 is the lesser occipital, number 2 is the greater auricular, number 3 is the transverse cervical cutaneous, and number 4 is the supraclavicular nerves. And the last content of posterior triangle is going to be an artery which is seen here, an artery which is a branch of external carotid. That's the occipital artery. Occipital artery. It's a branch of external carotid. Fine. Let me just put this on the paper, students. Contents of posterior triangle. Let us just put this on the paper. Contents of posterior triangle. Number 1. Contents of posterior triangle. Number 1 is subclavian artery. Subclavian artery. Second is the brachial plexus. I'm writing in short, brachial plexus. Third is the spinal accessory nerve. That's number 11. Lies on which muscle? Levator scapulae. Fourth is the cervical plexus. Cervical plexus. And what are the branches of cervical plexus? I'll just mention this for you. Branches of cervical plexus. One is the lesser occipital. Lesser occipital. Second is the greater auricular. Greater auricular. Third is transverse cervical cutaneous. And the fourth is supraclavicular. Supraclavicular. Okay, so lesser occipital, greater auricular, transverse cervical, and the supraclavicular. These are the branches of cervical plexus. And the last content is occipital artery. Occipital artery. Am I clear to all of you? So this becomes the contents of posterior triangle of the neck. The most important content is spinal accessory nerve, lies on the levator scapulae, and if we damage the spinal accessory nerve in the posterior triangle of the neck, the muscle affected is trapezius alone, not sternocleidomastoid, only trapezius. I hope I'm clear to all of you. Just one last thing. Boundaries are clear, floor is clear, Floor is covered by prevertebral fascia, that's clear. Carried into the axilla as axillary sheath. I hope this is clear. Then contents you've understood. What is left? What is left now? Roof, roof. What is left is the roof. Roof is left. Have a look at this now. So, just have a look at this. So these are the branches of cervical plexus. Number 1, that's the lesser occipital. Number 2 is the greater auricular supplying the skin here. Number 3 is the transverse cervical cutaneous. And number 4 is supraclavicular nerve. So this becomes the branches of cervical plexus. We have seen this before. So that's the posterior triangle of the neck. This is the scalenus medius. That's the scalenus posterior. That's the levator scapulae. Okay, this is the semispinalis capitis, and splenius capitis, and that's the semispinalis capitis. Semispinalis, splenius, levator scapulae, scalenus posterior, scalenus medius, and what's this small muscle? Scalenus anterior, which lies behind the sternocleidomastoid. What are you seeing between the scalenus anterior and medius? That's the brachial plexus, and there would be the subclavian artery also. On this levator scapulae would lie a nerve. What is this nerve here? The spinal accessory nerve. That would lie on the levator scapulae. Clear to all of you? Okay, so this is the posterior triangle. You can see here. That's the posterior triangle of the neck. That's the spinal accessory nerve, which is seen here. Perfect. Clear. Now just try to understand this. See here. See the slide. This is the scalenus anterior muscle. And how do I know this is scalenus anterior? I can see a nerve here. Look at that. You can see a nerve here. That's the phrenic nerve. Phrenic nerve, which lies on the scalenus anterior. That's the brachial plexus subclavian artery. So behind this is going to be the scalenus medius. That's the sternocleidomastoid. That's the trapezius. That's the trapezius. I'm so sorry. That's the trapezius. That's the sternocleidomastoid. That's the clavicle. So that's the posterior triangle of the neck. Clear? So understand in all different views. The last thing to understand is the roof of the posterior triangle. Now this is a section, students. This is a section. If you can tell me what is this muscle? That's the trapezius muscle. That's the sternocleidomastoid muscle. Now this fascia in red, this is the deep cervical fascia. This is the investing layer of the deep cervical fascia in red. Now deep cervical fascia will take as a separate topic. Now this investing layer of the deep cervical fascia begins from the spines of the cervical vertebrae. It goes laterally. It gets this muscle here. That's the trapezius. It splits. It encloses the trapezius muscle. Look at this red. Encloses the trapezius muscle. Now comes here. Now this fascia is going like this, like this, like this. So what is this fascia going to form? See, this is trapezius, this is sternocleidomastoid. So what is this area? Posterior triangle of the neck. So it is going to form the roof of the posterior triangle of the neck. Comes here, gets this muscle, sternocleidomastoid, encloses the sternocleidomastoid. Now goes like this, like this, like this, forms the roof of the anterior triangle. Comes in the midline, joins with the fascia of the opposite side. Clear? Look at this. Once again, look at this slide. This is a very important slide. A section through the neck. That's the trapezius muscle. That's the sternocleidomastoid muscle here. So what is this area going to be? The posterior triangle of the neck. This is the anterior triangle of the neck. This is the midline of the neck. Midline, right? So this is the posterior triangle. So this fascia, which is known as the investing layer. Investing layer of the deep cervical fascia. Investing layer of deep cervical fascia begins from the spines of the cervical vertebrae, encloses two muscles, trapezius and sternocleidomastoid. It is going to form roof for two triangles. This is the posterior triangle and that's the anterior triangle. It forms roof for these two triangles. So roof for the posterior triangle is formed by investing layer of the deep cervical fascia. Clear? So that's, see, these are the boundaries. Ye clear enough, students? Are you able to follow this? Now, what is this sternocleidomastoid and what is this trapezius? So this becomes the boundaries. What are these muscles? This becomes the floor of the posterior triangle floor. And you can see this yellow colored fascia which is covering the muscles on the floor. That's the prevertebral fascia. So this yellow is the prevertebral fascia which covers the floor of the posterior triangle. And this roof is formed by the investing layer of the deep cervical fascia. So students, can you tell me what is this space? What is the space occupied by? This is the space, right? So this is the floor, this is the roof. So this is the space which is occupied by the contents of the posterior triangle, the contents. Are you clear? Are you clear, students? Are you clear? So these are the boundaries. That's the floor. The floor is covered by prevertebral fascia, and that's the investing layer, which is going to form the roof. Between the investing and the prevertebral fascia, this space is filled by the contents. Contents, the subclavian artery, the brachial plexus, the spinal accessory nerve, the cervical plexus, and finally the occipital artery. I hope, students, I'm very clear with the posterior triangle, with the contents, with the boundaries, with the floor, with the roof of posterior triangle, and a very, very important MCQ that you get on the posterior triangle of the neck. Is this clear to all of you? Thank you so much, students. Thank you for your patient listening. In case of doubt, do get back to me. Thank you.